Hospital, and Dr. Veer Pushpak Gupta, National Health Service UK, joining us from London. Thank you, doctors, for sparing your valuable time. Dr. Gupta, I want to begin by asking you, the UK variant is predominantly being seen here in India as well. Did you see pulmonary changes, lungs being severely affected in patients in the UK?
Well, thank you for having me on the show again, Rishika. Yes, we did. I mean, we saw a higher infectability of this variant, the B117. We saw younger people being infected. We saw more admissions to ICU, particularly of younger people. And the changes that you're talking about in the lungs is what the virus does generally, because the virus causes an intense immune reaction, which causes an autoimmune cytokine storm, as we call it, which destroys lung tissue in the process. So yes, the answer is that we did see lung changes. We saw higher infectability and more ICU admissions, and that's exactly what's happening in India at the moment.
Dr. Jain, you're a specialist in this field. What are you witnessing? Because many experts are saying that lung infection is being seen in those patients without comorbidities as well.
Yes, I think I would agree with that, because last year when we saw the COVID cases, there were severe pneumonias which we thought would slowly progress to a lot of interstitial fibrosis. But, you know, the number of cases who were devastated in a matter of days or weeks were lesser. This year, we are definitely seeing more cases. And the worrying thing, I don't know whether the others have the same experience, what we've seen here is that the disease tends to suddenly become more severe after first 4 or 5 initial days of relatively mild disease. Then it suddenly becomes more severe, and in the second week, up to 2 to 3 weeks, the disease suddenly takes up, and you know, the fever and the lung involvement becomes very severe, and it doesn't respond to a lot of the treatment that we've been using. And what makes it more dangerous is the highly infectious strain that we are seeing. It is transmitted so easily that, you know, the number of people, it's not surprising that the number of people that we are seeing has gone up in the way it has.
Dr. Mehta, would you tend to agree? You know, you're joining us from Pune, which is, you know, seeing an unprecedented surge in COVID-19 cases. You know, we know that this is a faster spreading strain. But are you also seeing a severity of lung infections in several younger patients? What's your assessment?
Good afternoon. I represent the Pune platform for COVID response, which is basically working with about 250 of the government and private hospitals in the city. And a lot of the analysis that is being done by the group is actually showing a combination of different things. First and foremost, it's not just the old people who are getting infected and are dying. We are seeing a lot more of the younger population, which is now getting infected and unfortunately is having fatalities. That's number one. The second point is also happening is the deterioration seems to be much faster in a number of cases. So the deaths after admission seem to be much faster than the first wave. The third and most important fact is that the virulence of this seems to be much, much more. So while Pune had an earlier peak, this time the peak has been much, much more. And the prevalence in rural areas also has been much more, and more members of a particular family do tend to get infected. These are some of the factors that we are seeing in the statistics that we are looking at.
Right. Dr. Gupta, you know, very briefly, I want to ask you solutions. You know, when we're talking about this rapidly spreading variant, you've just been through it. The UK, if we can put out that graphic, you know, one can actually see that there's been a steep decline in the number of daily cases after going through, you know, perhaps one of the worst phases. What would you quickly recommend? What are the fixes?
You know, I've been saying this time and time again. I was very sad to see a few months ago when weddings were happening, social events, gatherings were happening, people were let to do whatever they want. You can't do this with this virus. This virus mutates very, very fast, and it can affect populations that were never affected before. So, I mean, the three things that we did here was effective vaccination. You know, vaccinate as many people as you can, at least with one dose. Even one dose protects you with 70% immunity. So, you know, vaccination should be the #1 priority for the government. Effective lockdown measures, social distancing measures, hand hygiene, these things need to be repeated time and time again. We cannot put the foot off the gas. That is the most important thing. And if we get complacent then we will see what is happening in India. And we need to get back on it where we were last year and get, focused on doing these things all over again. Otherwise, this is going to rampage through like it did in the UK. Now, if you look at the UK's numbers, we're down to about 500 cases a day from 50,000. So clearly these measures work.
Yes.
Other countries have tried it. So I think that the government needs to be very focused on these measures now and take it very, very seriously before disaster takes over.
Well, I think your perspective is very important. You having the benefit of hindsight, I think there's a lot that India can actually learn from what the UK did right in terms of both vaccinations as well as effective containment measures in terms of, micro containment or mini lockdowns, some of which is already being implemented here in India. We have our first caller, Sanju, dialing in from Mumbai. Go ahead.
Hi.
Hi, go ahead.
My question would be in two parts. First is that my mother has got the first vaccination dose, which is Covishield, and she's going to take her second vaccination dose in a gap of 7 weeks. That is, she's scheduled on the 26th. So I'm following the protocol which is being advised, like to take the second dose between 6 to 8 weeks. So my question was that once she finishes this vaccination dose, and when Sputnik comes into the market, can a person who has already been vaccinated by a vaccine which is 70%, having 70% efficacy,
right,
and then take a Sputnik vaccine which will have 90% efficacy?
All right. Dr. Gupta, would you like to take that on?
So I just want to reiterate her question. So she's saying, can you take another vaccine after you've taken the second dose of the first vaccine?
Yes.
Yeah, I don't think that is advised. I think if you've taken a particular vaccine, in your case you took Covaxin, you should stick to that for the second dose. And after that, you do not need another vaccine. That is your protection. Right. That is your immunity. So, percentages don't matter much in these cases. The fact that you have antibodies is the most important thing, and you will be able to fight off the infection effectively with those antibodies.
So your mother has taken Covishield. She must take the second dose of Covishield, and there's no need to take another vaccine that may have a higher statistic at a later date. That's an important clarification. Arpan Bose is dialing in from West Bengal. Go ahead.
Good afternoon, Rishika ma'am and other respected doctors. I am Arpan Bose. I have two questions for all of you and for the world also. First of all, I want to ask that arsenic album 30, a homeopathic medicine, which had played a major role during the COVID pandemic. So we can take it after taking vaccine. And secondly, I want to ask those who have stones in kidney, they what COVID can do with them.
Dr. Jain. Okay. Thank you for your question, Mr. Bose. Dr. Jain, homeopathic medicines, can they be taken or on a continued basis after vaccination?
So I think the principle of treating any disease with any drug, whatever system of medicine it belongs to, has to be vetted and approved by the drug controller for use in that particular system. Now, it's not just modern medicine. All systems of medicine have to go through that. We can stake claims to anything. I must admit, I am not knowledgeable enough. I have not seen any data on this. So I would not recommend anything that I don't know about.
Right. Dr. Gupta, would you like to comment on how a patient with kidney stones could react if they contracted COVID?
Patients, when they have comorbidities, when they have other diseases, will obviously be more susceptible to a greater infection with COVID. There's no particular indication that kidney stones would cause a greater infection with COVID, and I think that they should just follow the same principles of treating themselves, self-isolating, taking care, and obviously maintaining their own symptoms and monitoring their own symptoms, and making sure that they're not in need of hospital care.
All right. We have Prema from Pune dialing in. Go ahead.
I'm calling from Pune. I have called quite a few private hospitals in Pune for taking Bharat Biotech's Covaxin first jab. But they are telling that they don't have it for first dose. They have only for second jab. But I want to know whether it is going to come in future or they are going to stop it, or year end when they are collaborating with Haskin, then only they are going to roll out.
Okay, we also have Shachi Joshi from Delhi. Let's take that question and then I'll have both answered.
Yeah, ma'am.
Go ahead,
Hello.
ask your question.
Yeah. My question is that my husband is 52 years of age. He's suffering, he's having diabetic and he's on insulin. He got corona during end November and his fever continued, very high fever, for about 14 days, ma'am. And twice RT-PCR test did not detect that he's having corona. But after he was okay, after a month or so, we felt that he's having corona because medication given was the same. So we went for antibody test, and antibody was so high, it was around 137.
Okay.
Now, my question is whether he needs to go for vaccination,
Right.
number one. Number two, if at all he has to go, which vaccine he should be taking?
Okay. Important question. Let me first take Prema's question to Dr. Jain. Dr. Jain, the supply of Covaxin, if it's running short in certain hospitals, as this viewer is reporting, what should they do about the second dose? Should they wait?
I must admit I am not aware of any such official information that we are going to run short on the Covaxin. As far as I have heard, that they are actually going to ramp up production and there will be enough second doses to go around.
Right.
And I do not think that the government will be so irresponsible that they will start the vaccine without having, the adequate numbers. So I haven't heard anything to that effect.
Okay, so you should perhaps cross-check that information as well. To our viewer, you must contact the nearest hospital and cross-check that information. Dr. Gupta, would you like to answer the question about the 52-year-old diabetes patient who has very high antibody count now? Which vaccine should he be getting, if at all he should be getting one?
Whichever vaccine is available in that area.
Okay. And he should get the vaccine still?
Yes, you should get the vaccine still. Antibodies, because of previous infection, do not ensure that antibodies will remain in the future. With the new variants coming in, with the different infectability of the variants, it's essential that you get protected with the vaccine. Whichever vaccine is available, please go and get it.
All right. So that's something that all experts have reiterated time and time again on the show. Thank you so much, doctors, for sparing your valuable time and answering our questions so very patiently. We're going to slip into a very short break at this moment, but coming up on the other side, we'll talk to a top expert from the United States on the issue of blood clots that's been found both in AstraZeneca as well as the Johnson & Johnson vaccine. Stay with us.